Looking at Gauteng now, where 66,891 positive COVID-19 cases have been reported. The province has seen a sharp increase in cases over the last month, edging it closer to the figures seen in the Western Cape. There have been talks about Gauteng looking at tightening the lockdown restrictions. However, the province does not have any plans to move back to level 5 of lockdown. To find out more about the plans that are in the pipeline for Gauteng, we are joined by Thabo Masebe, the Deputy Director General for Gauteng's Provincial Communication Services. Thabo, with regards to the high number of cases being seen in Gauteng, what are the plans to flatten this curve in the province?
Well, the high numbers, first of all, we did expect that the numbers would start growing by around this time, although our own modeling showed that the numbers would grow sharper towards the end of July and beginning of August. So we started seeing the large numbers quite earlier than our own modeling, but we've been expecting it. So the health system is ready for that. Obviously, some of the people who get infected will require a hospital care. So we will be able to admit those that require hospital care. They will be admitted both in the public hospitals and some of them would be in the private hospitals. But as far as ensuring that the virus does not spread as much as it is now, we will obviously have to continue to get the people to observe the rules, to observe the regulations, to avoid large gatherings and movement of people unnecessarily. So as the economy reopens, we obviously do expect that more people will have to go to work. The schools have also reopened, or some of the grades have reopened. So it's going to be a little bit difficult, but we'll continue to appeal to people to observe the physical distancing rules, to continue practicing hygiene and wearing a face mask to protect themselves and those around them.
But what sort of situation are we going to be faced with in terms of ensuring that the movement is comes to a bit of a low? Because there is a lot of movement at the moment and people are not wearing their face masks. So how will these plans be enforced?
Yes, there's a lot of movement. That is what is concerning us. And there's a lot of people are also organizing gatherings. They are behaving as though there's no lockdown. So the first thing that we're going to do is to remind people that under level 3, there is still lockdown. So those that are not going to work or taking their kids to school or going to buy essential goods will have to remain at home. And people are still not allowed to visit each other or to visit their friends and relatives. People are not allowed to organize parties. So these are the things that, first of all, we will have to remind people that they cannot engage in those kind of activities. And of course, the law enforcement agencies, the police assisted by the South African National Defence Force, will have to be out in the streets and everywhere where people might be gathering to remind them that they cannot be gathering, because the more people gather, the more risky they place themselves at risk of contracting the virus.
And Thabo, in terms of the SANDF, how many more soldiers will be deployed in Gauteng? Will it remain the same or will there be more deployed?
Well, we don't have the exact number, but the appeal we've made to the national government is that we need to see more people, especially in some of the hotspots in the province, to ensure that we prevent all of these gatherings from happening, and that we restrict the movement of people on the roads and in the streets.
In terms of hospitals, how many of them are already full to capacity in the Gauteng province?
Well, most of them, Chris Hani Baragwana is experiencing pressures, and some of the hospitals in Ekurhuleni, in the East Rand, they are also experiencing a bit of pressure, and the hospitals around Pretoria are also feeling the pressure. So in all parts of the province, the public hospitals are already feeling the pressure. So we have now started admitting people at the temporary facility. One of the big facilities is at Nasrec, where we have about 500 beds, and we plan to increase it to around 700. So some people are already at that facility. And at the same time, we're also planning to build a few field hospitals to ensure that as the numbers grow, we do have capacity to admit more people.
And then in terms of the rumors that were going about that there's going to be lockdown level 5, can you just tell us the facts about that at the moment?
There will not be lockdown level 5. We remain on lockdown level 3, and that is in line with the risk-adjusted strategy that is being employed by the national government. I don't think the national government would consider going back to level 5 because of the major implications that such a move would have on the economy and also on the fiscus. Because level 5 means you're shutting everything down. So at the time when the government decided to go into level 3, it was a well-considered decision, having looked at all the risks that come with it. So it is about ensuring that we remain, we continue to practice or to behave in a manner that does not lead to more outbreaks. So it's really the message that we're putting across now is that the coronavirus depends on the individuals, that all of us as individuals have to play our part to ensure that we protect ourselves, I protect myself, and protect the next person that would be around me.